Hello, I am Dr. Luis Sanchez, and this is the Society for Vascular Surgery briefing about vascular disease in the Hispanic community. Peripheral arterial disease, or PAD, is a condition where fatty deposits build up in the inner lining of the leg arteries. Although often silent, when severe, these blockages restrict blood circulation to the legs, producing symptoms that may significantly affect function and quality of life. Left untreated, PAD may be associated with a significant risk of heart attacks, stroke, or death. Only rarely, PAD may progress and lead to gangrene and amputation of limbs. PAD is a highly prevalent public health problem affecting 8 to 10 million Americans of all race and ethnic backgrounds, including Hispanics. Projections from the 2000 United States Census indicate that Hispanics currently represent about 15% of the U.S. population, 47 million, and that by the year 2050, an estimated 102 million Hispanics, nearly 24.5% of the total U.S. population, will reside in the United States. Compared with other racial and ethnic groups, the epidemiology of PAD among Hispanics has some particular features, including differences in the prevalence, risk factors, treatment, and outcomes. The prevalence of the disease among Hispanics is not well known, and estimates have varied widely, with rates in the range of 1.8% to 13.7%. Nevertheless, most available studies assessing PAD among Hispanics have included primarily hospital-based and clinical settings, which are prone to individual selection bias. It is believed that all the barriers that limit the access of the Hispanic population to the healthcare system have played a role in the difficulties found by the investigators to determine the true prevalence of PAD in this ethnic group. Risk factors for PAD in all ethnic groups include advanced age, smoking, diabetes, high cholesterol, low physical activity, and high blood pressure. However, there are some variations in the relative importance of these risk factors for PAD among Hispanics. For example, although smoking is the most important risk factor for PAD, the prevalence of cigarette smoking among Hispanic men and women is lower than that seen in other racial or ethnic groups. In contrast, the prevalence of diabetes in Hispanics is 2 times higher than that of non-Hispanic whites, suggesting that diabetes is a stronger risk factor for PAD among Hispanics. Physical inactivity, another risk factor for PAD, is higher among Hispanics as compared with non-Hispanic whites and African Americans, and may have a role in the development of the disease in this segment of the population. In addition to differences in the frequency of risk factors, recent epidemiologic data also reveals ethnic disparities in the prevention and treatment of PAD and other related cardiovascular diseases. Some studies have demonstrated that Hispanics are much less likely than non-Hispanic whites to be screened and treated for lipid abnormalities and other cardiovascular risk factors. Although the pharmacologic treatment of PAD is well established, the frequency and adequacy of these therapies among Hispanics are unknown. Furthermore, current evidence reveals that Hispanic patients with lower extremity arterial disease present with more advanced disease at the time of diagnosis and exhibit poor outcomes after revascularization procedures, including a higher rate of limb loss as compared with non-Hispanic whites. Given the sociocultural characteristics, the limited access to healthcare, and health disparities experienced by Hispanics, the traditional healthcare model probably is not the best approach for prevention and treatment of PAD in this ethnic group. New approaches, such as community-based interventions including non-invasive screening tests for PAD performed in community settings, the implementation of risk factor modification programs, and supervised exercise therapy could potentially lead to earlier detection and treatment of the disease in this ethnic group.
This briefing is made possible by a grant from Cook Medical. To learn more about vascular health, visit vascularweb.org.